about concierge medicine and how it's different from traditional medical practice. So, Dr. Jelen, how does being a concierge doctor allow for you to create a more personal relationship with your patients?
The biggest thing is the time that I get to spend with my patients. Typically, in a regular practice, you have 2,000-3,000 patients, and so doctors are seeing 18 to 20 patients a day or more, and they're rushing in and out of the room, but my patient load is much less. And so I have, 30 to 1 hour appointment time, so I get to really sit down and delve into the problems with my patients and build that strong relationship and trust.
Oh, that's great. So, Dr. Ivan, what's the value of being able to build that deeper relationship with your patients?
Well, ultimately, the value that we have to have in mind is the outcome for the patient, is reaching the right diagnosis, providing the patient with correct treatment. So we are able to, with that extended time that we are able to provide our patients, we are able to sit down, listen to their complaints, not to rush them, but let them explain to us how they feel. We are able to go over necessary testing, and when they come back, we're able to actually go over the results, explain everything so they understand what's going on. And that extra time we are able to take ultimately leads to hopefully achieving diagnosis faster and providing them with better outcome.
Wonderful. Can you possibly give me some specific examples of cases where that's made a big difference for one of the patient's health?
Sure. Actually, one example just happened last evening. I got a text message from a patient saying that she was having what sounded like cardiac symptoms. So I had her come in this morning, and we get to see our patients right away because our schedules allow that. And so that was nice that she didn't have to wait. And when she came in and we really spent time talking, we discovered it was really more issues going on in her life and more anxiety related than actually cardiac. So we were able to address that and avoid any, additional unnecessary testing and anxiety for the patient. And then another really good example, I think, is recently I had a young patient come to me with a diagnosis of cancer. And of course she was frightened, and when you hear that diagnosis, you can't really think about what your options are. And so when we really got time to sit down and talk about it, we thought about sending her over to Moffitt for a second opinion, and she did talk to the doctors in Fort Myers, but ultimately decided to go to Moffitt. And she ended up in a clinical trial that I think is going to be beneficial for her in the long run. So it gives us that extra time to think outside of the box and do the best we can for our patients.
Oh, that's wonderful. Now, I know that you have had some patients who have switched over from their other primary care doctors. What is the reason that they give to you that they want to come over to you as a concierge?
The main reason is where they feel that they were not explained or they did not understand what was happening. They felt that their problems were not addressed fully by the physician they saw prior to coming to us. So a lot of times they come with records, with copies, and we are able to sit down, go through it, explain to them exactly what's going on, look whether anything was possibly overlooked in the past, and come up with a proper plan for them.
Great.
But probably the communication and the lack of understanding is many times what drives patients to come to us.
That's great. So what's really the next step that if someone is actually interested in finding out more about being with a concierge doctor, what's their next step that they need to take?
Well, I think, the most important thing is really for people to meet us and to come in for a complimentary consult, sit down and talk to us, and so that we know what, their expectations are and what we can offer to see if it's a good fit. And oftentimes just meeting the doctor helps them to make that decision.
Okay, wonderful. Thank you so much.